the numbers in South Australia are slowing slightly at the moment. And so my strong message to all South Australians is go out and make sure that you have that vaccination. It will keep yourself safe, your family, your work colleagues, and in fact, it will keep the entire state safe. Now, what we're doing today is, I think, outlining what we need to do in terms of test, trace, isolate and quarantine that will be different come next Tuesday. Still important that we do have these precautions in place. There's certainly a large part of the Doherty model that the National Cabinet relied upon to make sure that we could safely open those borders. As everybody knows, here in South Australia, we're signed up to that National Cabinet framework, which said that we would lift those state borders at 80% fully vaccinated, and that's precisely what we're going to do. We do know, though, that this requires us to keep some public health and social measures in place, and so there'll be no changes to the public health and social measures in South Australia until we get through to that 90% fully vaccinated rate. But we will be very, very significantly reducing the test, trace, isolate and quarantine requirements. Now, you would recall that in the past we've had to take a pretty heavy-handed approach, quite frankly, because a single case could set off a cluster which would lock down our state. And we've said, as of next Tuesday, we will no longer have the threat of a whole of state lockdown. And that's going to be a huge relief to businesses and families in this state. We've also said we will remove the whole of state lockout, but when somebody does become infected, and it's inevitable that they will need to do the 14 days of quarantine. Now, what's of most interest, I think, to businesses and to individuals is what other isolation needs to occur. Now, in the past, everybody who was a close or casual contact would need to go into 14 days of quarantine. Well, that's no longer going to be the requirement. For people that are unvaccinated, for people that are vaccinated, fully vaccinated, the worst case scenario is 7 days of quarantine if you're a close contact. So this is a very big motivation for people to go out and get vaccinated as quickly as possible. The Communicable Diseases Control Branch will be doing the risk assessment on outbreaks, and they will be providing advice to individuals and to businesses about the people that will need to go into a form of isolation or testing regime going forward. Now, that risk assessment will be based on a number of areas. First of all, how close was the person coming to the infected person? Are they within 1.5 metres, or is it a much larger distance? Were the two people wearing masks? Was it in an indoor space? Was it an outdoor space? What was the size of that space? Was there any physical contact? And what is, of course, the vaccination status of those two people? So as you can see, a large number of considerations are looked at before we direct somebody into quarantine, or in fact, in many instances now, just direct them to get some ongoing testing. We're trying to have a more bespoke, tailored approach away from the approach that we had previously, which was very heavy-handed, where everybody who was a close or casual contact needed to go into quarantine. We're hoping that this is going to very, very significantly reduce the number of people who will need to go into directed quarantine, but this still will be necessary, especially in this next period when we're between 80% and 90%. I think the other big relief for businesses is they will no longer need to close for deep cleaning following exposure in their site. Now, obviously, we'll still need to follow the directions of the Communicable Diseases Control Branch, but the type of cleaning that is required in this next phase from Tuesday onwards is at a significantly lower level. So big changes, important changes as we open the borders to people from New South Wales to Victoria and with the ACT. So long as they are fully vaccinated, there'll be some very happy faces, I think, in South Australia, people that have been dislocated for a long period of time. And of course, many South Australians now able to go to Sydney, go to Melbourne, go to Canberra, visit people interstate, whereas previously when they came back, they would need to do 14 days of quarantine. That won't be the requirement for fully vaccinated South Australians going forward. So I'm happy to answer any direct questions now, and I'm sure you'll want to hear from some of our other speakers. Tom.
The switch from the deep clean to the regular clean, is that because of a recognition that it's less surface-based?
No, it's just really to do with the transmission potential. When you had a very low-level unvaccinated population, then we knew it could spread extraordinarily quickly. And what we know now is that as we get towards 80%, then 90%, it's not going to move as quickly. As we said, previously we had almost a zero tolerance to community transmission, and that meant one single infection could set off a cluster which would lock down the entire state. But as we get above that 80% threshold, that's no longer the threat. The risk is reduced, and so therefore we will reduce the requirements on individuals and businesses, whether that be test, trace, isolate and quarantine, or whether that be that deep cleaning. So there'll still need to be a cleaning, but it won't be where we're basically closing the business for a couple of days, sending people in hazmat suits. It will be a different level.
Renee, can I just ask you, sorry,
Yes.
on QR codes, are you concerned that, given the fact that there is still a regime for some quarantine and particularly for unvaccinated people, are you concerned about QR codes and people not checking in?
No, because I think South Australians have done the right thing since day one, and I fully expect them to continue to do the right thing. South Australians have proven time and time again that they'll do the right thing to protect our state, and they've reaped the rewards of being in a state which has had low-level infections. We've had very low-level restrictions compared to most other parts of the country, most other parts of the world. We've had excellent health outcomes, but that's been because of the partnership that we've had with the people of South Australia, and I fully expect that to continue into the future.
There doesn't appear to be anything specific in schools in this modelling. When will schools know how they handle a COVID case, especially when under 12s are considered unvaccinated?
So we will be releasing a series of these more specific and targeted. There will be one which is for education. There will be one for critical infrastructure in South Australia, for primary and community health, and there'll also be one for essential businesses, for example, transport and freight. But today we're getting our general information out, and for those, the vast majority of small businesses in South Australia.
Why isn't that ready today? I mean, we're only a week away from opening up for schools. There's not much time.
No, as I said, we've been working through all of these, wanted to get this out as quickly as possible. We only received that final Doherty modelling, I think about 8 days ago, and so we've been working through that.
On the modelling, you were waiting at more modelling around the 90%, because you've said that you won't ease further restrictions to a 90%, but that hasn't been modelled yet, has it? So you're still awaiting that?
So we've got some modelling, but of course what we're going to have very soon is real data, and that will be put into that model and give us a greater level of accuracy. Now, we've said since day one we haven't wanted to have a single measure in place for a day longer than we need to, but we also know that these public health social measures need to be in place, especially as we're between 80% and 90%. This is the same arrangement that's currently occurring in New South Wales, Victoria, Queensland, the ACT. It's the basis of the Doherty model. But as we learn more about the disease, as we look at different treatments, we can start to ease some of those public health social measures. Things like masks, which I know can be very annoying, but they're necessary at the moment, especially as we open those borders. But further down the track, we may look to ease that. We now already say that they're only required for indoor public spaces, and I think this has provided huge relief for people, although plenty of other people would like to have them completely removed. But the modelling on this, for example, is very, very clear that at the moment, at that 80% threshold, it is still much safer to keep those masks on in those public spaces, those public indoor spaces, and so we'll be abiding by that. But we will be getting more modelling. We will be updating that modelling. We'll be putting the real data in. We'll be looking at the experience interstate and applying it here in South Australia, and I hope that we can continue to ease those measures. I hope that we can continue to keep South Australia safe.
Just to be clear, are you saying that masks will definitely be able to go at 90%, or that depends on what the modelling
Still
shows?
working through all of that at the moment. There still will be requirements to be wearing masks for a long time in certain settings, high-risk settings, for example in hospitals and aged care facilities where people really are coming to close proximity, especially for vulnerable communities. But the full detail regarding that, we're going to wait until we get some further modelling back, and also just see how we go. If you like, we are lifting the border to south for our state borders on the 23rd of November. We are putting a strong condition that people need to be fully vaccinated before coming in, but new cases are inevitable. What we want to do, though, is to push those new cases into the future as much as possible, because every day that we continue, we get that vaccination rate up higher in South Australia. It means we're more protected, which means that we're very unlikely to have the number of cases that we've seen interstate, because we're starting at a much further, more vaccinated status than those other jurisdictions.
Just to clarify, allowing fully vaccinated travellers from the eastern states in come November 23. So will we be checking, like, will the border checkpoints still be set up and you'll be checking vaccination status, or are you pulling back police numbers at the border?
Yep. So on that, can I just say others will be able to come in, but they will still be required to do the 14 days of quarantine. So we still are managing people to come in, even if they're not fully vaccinated. Preferable is, and I think most people will now get fully vaccinated. I look at the statistics interstate at the moment, and it is outstanding. You're looking at well above 90% in many places across the country at the moment, which is absolutely fantastic, and that gives me great confidence that that's what we'll be achieving here in South Australia.
So
in terms of as people come in, we will be requiring them to, if you like, pre-register, and we'll be releasing the details of that very soon, and they will need to put all of their details there. There will be some inspections on the border, but nothing like what we had before. Because if you think about it, going back 3, 4, 5 months ago, a single case could have set off an entire cluster and locked down the state. That's no longer the risk. And so, of course, police resources would be better utilised in other areas. But the strong message is that you could be stopped, you could be inspected, and if you've done the wrong thing, well, there will be consequences.
And for the unvaccinated, will they be able to quarantine at a home residence or at a medihotel? For the unvaccinated people from the east that we're letting in? Well, again, we'll do it on a risk assessment as we get further down the track. If people can find places which are definitely isolation, not living at home with family and friends, then we have been able to accommodate that. And I think that that's been a very good initiative. And in fact, it was trialled here in South Australia, has now been taken up in Sydney and Melbourne. Andrew?
Premier, do you have a risk matrix in terms of when businesses have to close? According to the document here, businesses won't have to close unless advised by SA Health, cleaning cannot occur outside of business hours, or there's insufficient staff with business. What's that threshold for when a business has to close? Well,
we work through that with the individual business, so on their capability to do that deep clean, or that clean, and it's nowhere near the level that it was previously. But there is, I think, going to be a period where people are going to have to seek advice from the Communicable Diseases Control Branch. We've flexed the resources within this agency so that businesses and individuals will be able to make contact, work through their concerns with regards to a case that might come to their business. But the good news is that the requirements that would put essentially all customers, all staff requiring of a deep clean will not be the same going forward. It's a more nuanced approach, a more bespoke approach, a more tailored approach to reduce the requirements on the businesses or the individuals, but at the same time still keeping protection for our state.
So just to clarify your answer to Andrew's question, so you're saying people who are unvaccinated will be allowed in, but just in the way that they are now on, special case basis?
Correct.
Premier, are you concerned though that people who make a conscious decision to not get vaccinated are also the ones that are not going to comply with these rules?
Well, what I'm seeing around the country is extraordinarily high vaccination rates in New South Wales, in Victoria, in the ACT, and I expect that we will achieve the same here in South Australia. When we look at the statistics in terms of hospitalisation, those people that are being admitted into intensive care and of course being put onto ventilators, it is still essentially a disease of the unvaccinated. Now, I know there have been some people that are reasonably complacent about this in South Australia. Well, now is the time to go and get vaccinated. But the vast majority of South Australians, I think we're well above 85, 86, might be 87% now who have had that first dose, at least that first dose, which gives me, very strong confidence that we'll get to 90% around the end of the year.
Why not then say you're not coming in if you're not fully vaccinated? Why not say don't bother applying for?
Well, there are still certain circumstances where vaccination is not appropriate. There are sometimes medical reasons, and there are some compassionate reasons where people can't get vaccinated fast enough. So, look, we've proven ourselves to be as flexible as we can while still keeping a protection in place in South Australia, and that will continue into the future.
So there will be an exemption?
Yes.
Yeah.
Premier, is it correct that children under the age of 12, if they're obviously not vaccinated because they're not eligible at the moment, are considered unvaccinated? Because that would mean that anyone in their households under this plan would also have to do 14 days of quarantine if there's an outbreak at a school or anyone else, for example.
Well, we've got some specific advice in the plan for that. So if the parents are vaccinated themselves, they wouldn't be required to do that 14 days. But I might ask Professor Sperry to speak about this. Are there any more general questions for me? Yes, Andrew.
What about, would you consider, or is there on the table financial assistance for either any person who has to isolate under this plan, or if any business has to close under the plan?
Well, look, I think South Australia's proven to be very generous since day one with regards to this. We did have some payment plans in place earlier. There are no payment plans offered interstate or by the federal government at the moment. But look, if there is a need for that, we would certainly consider that in the future. I think since day one, we have made sure that we have got appropriate supports for businesses and individuals. But my goal at the moment is to do everything I can to make sure that we get as vaccinated as possible, that reduces that risk and has as few people in directed quarantine as we possibly can get. Earlier in the pandemic, at some stages, we had more than 10,000 people in directed quarantine in South Australia. I don't expect that that will be the case going forward.
Just as a follow-up, just confirming, there is no contingency plan in this plan for financial assistance to businesses or to people?
Not in this phase of the COVID plan. Andrea, and then I'll pass over to Professor Sperry.
When we hit November 23, the only change is going to be the household gatherings going up to 30 to 20. Other than that, other restrictions stay in place. When we hit 90%, could we see tough restrictions like have been released in Queensland, where pretty much if you're unvaccinated, you're going to go to the supermarket, there's not much else you can do?
So, look, my strong message is to encourage people to get vaccinated. Ultimately, we haven't made things mandatory in South Australia, except in certain areas where the National Cabinet has decided to make them mandatory, or I've received specific health advice that it's in the best interests of our state. But what we are now seeing is a very significant increase in the number of people that are getting vaccinated. I'm quite sure we'll get to 90% by Christmas. I think there are consequences of making too many things mandatory. Some people then dig their heels in and don't get vaccinated. I think the vast majority of people will look at the statistics and they will go and get vaccinated. I mean, if you had have told me 3 or 4 months ago that we would be heading towards 90% fully vaccinated by Christmas, I mean, I would have taken it any day of the week. It is an extraordinary situation, and for that I'm very, very grateful to the people of our state. I'm going to pass over. Oh yes, sorry.
Another topic. If a minister in your cabinet is found to have breached the Ministerial Code of Conduct, can they remain a minister after that? Well,
let's take a look if that ever occurs. But obviously, it's something that we take very seriously if there has been a breach, and that's ultimately my decision. Thank you.
Would you accept the word of the QC counselling?
No, I form my own opinion. I mean, look, if you're referring to the kangaroo court, the very expensive kangaroo court, which has occurred down in Parliament House in recent days, well, I don't think there's a single piece of evidence that would move my decision to 100% support the Deputy Premier of South Australia.
So just to be clear, if Rachel Gray hands down her findings and they are negative towards your deputy, it doesn't matter?
Well, the requirement under the Ministerial Code of Conduct is that I form that opinion, and I've looked at all of the evidence that was presented last week, so we'll wait to see what the Parliament throws up. But certainly, to me, there has been no conflict of interest whatsoever. The Deputy made the right decision. I back it 100%. I would have made the same decision if it was my requirement to make the decision.
On what basis can you say there's no perceived conflict of interest in this issue?
I'm just saying I don't perceive that there is a conflict of interest whatsoever.
If Parliament, if a no confidence motion in Vicky Chapman was successful in Parliament, would you sack her?
Well, I mean, let's look at the precedent there. I think Ian Hunter had 2 or 3 separate no confidence motions against him. He didn't resign and he wasn't sacked by the Premier.
Well, that was in the upper house, but in the lower house, I think the last president...
Well, so there's a difference between the two.
Yeah,
no, look, I've made it clear, crystal clear in fact, right since day one, that I have 100% confidence in the decision-making capability of Vicky Chapman. I've looked at the evidence presented to the Parliamentary Committee. It wasn't compelling at all. Nothing there moved me to lose confidence in Vicky Chapman as the Attorney-General and the Planning Minister in South Australia. I'm going to pass over now to Professor Sperry.
Thank you and good morning. And I'm very happy, obviously, to take some questions, but I just thought I might outline a couple of things looking at this new way of doing testing, tracing, isolation and quarantine. And just to put it into context, because of course we've learnt a lot since the beginning of the pandemic last year, and unfortunately we now have the Delta variant, so we need to take all of that into account when we're looking at our contact tracing. And we've also got the experience from New South Wales and Victoria. And so my team has been gathering all of that evidence to come up with this new matrix going forward. And of course, we won't just stop there. We'll be continuing to collect evidence so that we will be tweaking this as time goes on. And we'll be looking very closely at the number of cases in our community, and particularly whether or not we're overwhelming our healthcare system as a critical endpoint. But in terms of the Delta variant, and just to follow up on a question about the deep cleaning, we do know now very clearly that it is there's aerosol transmission, and that means that when somebody's speaking or singing or talking and they have COVID, that those little fine particles that come out of their mouth, those aerosols, hang around in the air afterwards. We also get some transmission through droplets. Droplets are bigger particles and they drop on the ground, which is why they're called droplets. And then we also know that there is what's called fomite transmission when somebody has touched, has the secretions on their hands and then touched surface, and then somebody else touches the surface and touches their own face. So there are those three ways of transmission, but with time it's become very obvious, particularly with Delta, that the aerosol transmission is very important and the fomite transmission is not as important. So we are changing the cleaning protocols for businesses because of that, and I think it's very reassuring that it is just the standard clean. However, a standard clean is not just a spit and a polish, it's actually a proper clean, but it doesn't have to be that level of deep clean that some businesses have undertaken in the past, and hopefully that will reduce the impact on the business and the length of time they need to close. One of the other things that we've done moving forward is providing this more detailed information to businesses, because what we found in some of our other outbreaks is the businesses were waiting to hear from us and we were so busy and we didn't always get back to them quickly enough. And so this gives some empowerment to businesses about what to expect if they have a case at their business. And the other thing is it means that they can start planning. And when you look at this information, you can start thinking about what you can do to protect yourself, and also businesses can start thinking about how to protect themselves. And just to be really clear here, we will be getting cases. This is a new phase for us in South Australia. In some ways, other than that first wave, we haven't experienced a pandemic. We haven't had a large wave like New South Wales, ACT and Victoria. And so we are coming into that and we have to expect cases. And because of that, we do have to go back to the behaviours that we might remember from last year. And I've reminded people from time to time, but these are going to become critically important now come the 23rd. So the basic messages for people in the public to keep yourself safe, to be protective, are that we don't want you to be touching other people. So I'm possibly the one last person in South Australia that still doesn't handshake, but I want you to join me with that. So you'll see on our matrix, if you have got physical contact with another person, you're much more likely to need to have a quarantine period. So that 1.5 metres of physical distancing is very important if you're out and about. Keep your distance from other people that you don't know. Outside, as the Premier said, is much safer than inside, and that's because of the aerosol transmission. Wear a mask, it keeps you safe, and if you are a case, it stops those secretions coming out of your mouth and infecting other people. Please don't go anywhere if you have any symptoms whatsoever. You need to go and get a COVID test, and that is going to be absolutely critical going forward, because TTIQ is testing, tracing, isolation and quarantine. So the first bit is we do need to have people being tested, and our SA Pathology and private partners are ramping up their services ready for the 23rd. The best thing anybody can do is get vaccinated, because you can see if you're unvaccinated, you will be the one that has a 14 days quarantine, whereas if you're vaccinated, you will only have 7 days if you're a close contact. And then the last thing for us all in terms of public messages is the QR check-in is vitally important, because if we can't do the contact tracing, we can't stop those chains of transmission that start circling out into our community, and that will mean that the outbreak is bigger than if we all do the right thing. There's also some messages here for businesses, and when I was looking at all of this over the weekend and making sure that our graphic designer had everything lined up properly, I was thinking about businesses, and people might know my husband has a physiotherapy practice, and how might this impact him, and what would he need to do in terms of his business. So people thought about business continuity plans a year ago, so people need to go back to look at those again. There are many businesses with COVID-safe plans. Get out your COVID-safe plan. If you're a COVID marshal, maybe do the refresher course, redo your training. You might want to start considering whether you want all your staff vaccinated or not, because you might look at what we've provided today and think, gee, the implications are going to be much worse for me if I don't have fully vaccinated staff. You might want to think about whether you want unvaccinated clients coming in as well, and that might be something that you need to consider. If you have a waiting area for people that come into your business, you might want to consider not having people sitting in a waiting room. I remember last year taking my dog to the vet and being out in the car park and waiting for the vet to say it's time now to take your dog in. So people do need to start thinking about going back to those basic things that we talked about last year, and lots of businesses put these in place. And usually South Australia is a bit ahead of me. They usually start doing all of this stuff before we even tell people to. So those are things that I really wanted to point out today. The matrices are quite detailed. There was one question that was asked about children, for example, and we know that because kids less than 12 can't be vaccinated, then they are going to become close contacts if there's an outbreak in a school. And so there is some fine print. I'm not going to go into it in detail for the journalists from Sky News, but I think you'll be able to find that level of information there on the sheets that we provided. So very happy to take any questions.
Professor, when will you deem it necessary to close a business under these rules?
Yeah, so it's really going to depend actually on whether people have been fully vaccinated or not, and it also depends where the case is. So if the case happens, if you're talking about a scenario, for example, a restaurant, and the case is a patron, that will have different implications to the staff, as if the case was actually a member of staff and worked in the kitchen, because obviously a kitchen staff will be working with their colleagues in the back area. Now, if that happened and people were not fully vaccinated, then of course you may have the whole kitchen staff requiring 14 days quarantine, and that would by default have a business shutdown. However, if the business had realised beforehand that it's good to have all of your staff vaccinated, and also maybe have an A and a B shift so people don't overlap, it is absolutely possible for that business to continue to operate. So it's very difficult to say, Andrew. It's really on a case-by-case basis, and each business is different. We've provided this matrix for general businesses. It covers quite a lot of different areas, but we will have one, as the Premier suggested, we've got quite a number of other matrices for other sorts of businesses, essential services, for example, and we have some allowance for individuals if they're working in a critical area to be able to come out of quarantine and to do that particular job, but with a higher level of PPE, and that might be in something like energy, or in a particular situation where you couldn't not have that person there to perform that critical task.
Can I just follow up from that? Are you therefore suggesting that if you are unvaccinated and you work in a business, or the business is a majority unvaccinated, you are more likely to be shut down than if you are vaccinated? Am I reading that correctly?
Yeah, well, that's really those implications, and then I think it's also worth thinking about the overarching, if you like. If you are unvaccinated and your staff are unvaccinated, you are going to be the ones that catch COVID and get symptoms. You are the ones that are going to get sick. So if you have a fully vaccinated business here and a similar unvaccinated business here, this one is much less likely to have the disease in the first place. You're much less likely to have people that will come in and bring COVID there. So in that case, again, the message is, if you can have everybody around you vaccinated, you're going to have much less problems in terms of shutting down.
In which case, shouldn't we just make vaccination mandatory for hospitality workers? You know, the industry is calling for the government or authorities to take the lead on that.
Now, it is a very interesting question, of course, this mandatory vaccination and who should make the call on it. I actually have a text message from my beautician, and she has already decided that all of her staff must be vaccinated and all of her clients must be vaccinated without the government needing to step in. So actually, all of us as individuals and all businesses as individual businesses can start making those decisions, because there are three things that we can do in public health sense. We can have vaccination, but we can also reduce the number of people. So we could reduce, or a business could decide to have fewer people come into their practice or to their cafe or to their restaurant. And the other thing that they could do is then have more quarantine, and that's another public health option. So there's actually three public health options available in terms of those different measures. And so I think it is important that it's not just the government, but it's actually all of us to help take on all of those risks.
What's the legal framework for that, though? What if one of your beautician's staff chose to take legal action on their rights at work?
Now, obviously, as a public health physician, I'm not an expert in industrial law, but this person has obviously gone out and got their own legal advice and has proceeded in that way.
Professor,
in that regard, are we likely to see then in the next stage of restrictions easing that businesses' capacity limits will be based on whether or not they have mandated vaccination?
No, I'm just suggesting that in terms of a business themselves, as a business owner, there's a range of things that you could do. And there is a choice. And I always think that when we have choice in our society and when we look at it from, you know, it's more empowering. And from public health viewpoint, in terms of vaccination, persuasion is often better than coercion. So we have had a light touch throughout this pandemic in terms of lockdowns and stay-at-home orders compared to some of the other states, but we've worked hand in hand with the people of South Australia, with the businesses of South Australia. Of course, we've had to have some things in directions and some things have had to be mandated. And when we have vulnerable people, such as in our hospitals and in our aged care, we have required mandatory vaccination. And there are some other groups that we are looking at in terms of mandatory vaccination. But I'm not sure as a society South Australia would be that comfortable having a heavy-handed mandated vaccination for large numbers of our population.
Like your beautician, would you be encouraging other businesses to ban unvaccinated staff and customers?
What I would say is have a good look at the quarantine requirements for vaccinated and unvaccinated and start to think about what it would mean for your business. So you've got to look at business continuity plans, as I said, having teams of staff, an A team and a B team. You know, you could look at the vaccination status of your staff, but think it through for your business. There might be some businesses that don't have a public-facing role. There might be others that do, and those decisions need to be made by those industries and sectors and businesses themselves.
Professor, are you concerned about the places that have low vaccination rates, particularly the northern suburbs? How concerned are you about that?
Yeah, I am, because, you know, what I want to do is keep people safe, and I don't want to see people get sick, and I don't want to see people die. And so I really am very concerned for those particular suburbs. I'm also concerned for our Aboriginal community. I've worked a lot in Aboriginal health, and I just, you know, there's been fabulous work done by our Aboriginal leaders in our state. The rates for older Aboriginal people are pretty good, but there are many younger Aboriginal people that are not vaccinated yet. So I just think we all as a community need to support everybody to get vaccinated, but we need to do it in a way that's respectful of people's views, and also appreciate that sometimes the reason people haven't been vaccinated is they're scared. They're just simply fearful, and it's taking them a bit longer to make a decision on that point. Now, I suspect when we start getting cases in our state, people it will push them. They'll be more frightened of getting COVID than having the vaccine, and that's really what I'm hoping.
What sort of level of lockdown would you envisage around that? So you're not having statewide lockdowns, we've been told, up to the 23rd. So what would be the biggest sort of area, an LGA-wide, suburb-wide, business-wide?
Yeah, that's a really good point, and we've just had some recent Doherty modelling at a national level, helping us look at how we would deal with a local government area if we were really having difficulty, particularly with the vaccination rate low. What we've seen in New South Wales and Victoria is they've had a very successful response by using vaccine actually at the outbreak stage and going in there and really pushing the vaccine, like providing a lot of access for vaccines in those situations. And in fact, in Victoria, with some of their areas at the moment, they're linking testing and vaccination. So where they've had particular outbreaks, they'll be getting people tested but offering vaccine at the same time. So we're looking at all of those approaches because I think that there's the possibility, of course, that we might need that here in SA.
We still require for travellers coming from the eastern states for their LGA to not have a community case at the same time as it has vaccination below 80%. So are those travellers not allowed in?
Sorry, I'm a little bit confused.
When the rules were first announced that we're opening up in November 23, travellers from the eastern states who were coming from LGAs with vaccination below 80%, where there was also a community case, weren't going to be allowed in. Is that still
so those people will be able to they'll be able to come in, but we'll do a 7-day quarantine period. And it's an important thing to raise, Andrea, because we're watching those LGAs, only very few of them. Melbourne LGA was one of them, and also Sydney LGA. I've been able to get some really useful information from my Melbourne colleagues, and I'm intending to do the same with Sydney. Sydney is a bit higher, but Melbourne in particular, we were concerned that some of the data might be inaccurate to do with the denominator.
What are you doing about that data? If the population data is inaccurate and those LGAs are never going to be able to get to 80% because of that, is there any consideration to giving some leeway on that?
Yeah, that's exactly what I was meaning. So, of course, we will look at what the Commonwealth Government data shows, but if there's some discrepancies such as that, some inconsistencies, we'll obviously seek further information, which is exactly what I was meaning.
Professor, are we going to have? Are we looking at potentially thousands upon thousands of people placed into quarantine despite the casual contact, not needing to quarantine? Lots of people will be deemed close contacts because of the 15-minute rule. How are we going to be able to deal with lots and lots and lots of people in quarantine?
Look, unfortunately, we can't get rid of this virus. It's not going to just disappear. And in fact, for us in South Australia, we will be now having it come to our state. So we will need to have people in quarantine. What we have got, though, I guess, and we've been working very hard to make sure we have all of these plans in place, is not just looking at our hospitals as ways of dealing with people with COVID, but also having a hospital at home and a very good system to do that with a wraparound service. So we'll be extending that also to people who are in quarantine because we know that not everybody has a perfect quarantine accommodation and we need to look at alternative quarantine options for people. So when we look at TTIQ, we've been making sure we've got the testing. My responsibility is the contact tracing in our department, and our team is getting themselves game ready as we head to the 23rd. Then there's the quarantine and isolation. So isolation for people that actually have COVID, and we can't forget about those people. I mean, they may need some, many of them may need some health intervention, and some will end up in our hospitals. And then, of course, the quarantine. So we're making sure that we have good places or good systems in place to make sure people understand their requirements.
How confident are you that our hospitals will cope for those that do need to go?
Yeah, look, I might pass over to the Health Minister to answer that because I know a lot of work has been done. I've been involved with the Daily Huddle, which is the CE and a number of the LHN CEOs that get together, but I might just pass to the Minister for that one.
Quickly, can I clarify? If a child under 12 is not eligible for the vaccine, how does these rules apply to them and their families?
Yeah, so if you want to have take a look at this one, and there is some fine print here, and I just perhaps let you have a read of that first. Thank you.
As Nicholas Ferrier said, SA Health's been working for months now to be COVID ready on November 23. In particular, the government's investing more than $120 million in almost 400 additional beds, both in the community and in the hospitals. About half of those beds will be on stream by the 23rd of November, and further beds available over time. We're very confident that SA Health's planning is strong and that we will be ready on November 23.
Are you anxious though when we've had continual ramping and capacity issues at our hospitals across the board right now without COVID?
Well, there has been significant improvement in ramping in recent times. The 392 beds has certainly helped, and a range of initiatives on the ground to help flow. We're very keen to continue those efforts, as well as the investment of more than $120 million.
The nurses union today has come out, hitting out at the government for spending money on ads as opposed to the health system itself. What do you say to that?
I think it's really important that the community has confidence in the plans of the government as we move towards November 23. We want people to hear the public health information that Professor Nicholas Ferrier and her team are providing to them, but also we need to provide them with reassurance that if they do need hospital care, it'll be there for them.
What are going to be how is Tom's Court going to be used in the future? Obviously, not all the COVID cases can be in Tom's Court. How will it be used?
Well, has been explained in the past, we expect less than 5% of positive COVID cases will actually need inpatient care. Part of the other 95% will be what I'd call a hospital hotel rather than a medi-hotel for quarantine purposes. So some people will be receiving enhanced medical care and nursing care in a hotel environment, and my understanding is that 2 of the current medi-hotels will be segued to hospital hotels.
Which ones?
My understanding is that it's the Pullman and Tom's Court, but I can clarify that for you.
Minister, health unions have been pretty scathing of the government's health advertising. Is that advertising misleading given we've had record ramping, huge levels of overcrowding in the last year? No,
the government is very keen to make sure that the South Australian community appreciates that there is a massive investment in health. We are spending more on health in South Australia than any previous government, but beyond that, we're in this COVID-ready phase. We're investing more than $120 million more in both hospital beds, community beds and other forms of support. We're investing in very innovative programs such as COVID Kids, so that families who are supporting children who are COVID positive in the community will be able to connect directly with support and medical staff and be able to support their child at home. There's I feel like a fast tracking a lot of innovations that we've been developing over recent years. My Home Hospital, which the government's been putting in place over the last 2 years, has been escalated, and both in the children environment, the paediatric environment, and in the adult environment, is the foundation for what has been a very successful home quarantine program. It'll be the basis of hospital in the home and home hospital.
Any questions? Can we have a word, please, Commissioner? Sorry. Commissioner, what I asked the Premier earlier, are you concerned about people not QR coding because of the fear of being placed into isolation or quarantine?
No, I think the Premier's answer was right on point. Right throughout the course of our pandemic response, the South Australian community has done the right thing, and that has included QR coding. It was a slow start with QR codes, but people embraced that very quickly. I'm still seeing high levels of compliance, but if we do see a shift in that and it becomes critical in terms of our management of COVID-19 being introduced to South Australia, then we may take steps to remind people of their obligations. But it's important for businesses, if they want to maintain continuity, is to ensure that they are reminding people of their obligations.
How will your resourcing change from November 23, scaling back, or will you require the same number of officers dedicated to COVID?
In the first instance, on the 23rd of November, we'll have the same number of officers on our borders, but obviously with the significant increase in volume of people coming into the state, we won't be stopping every vehicle, but people will be reminded of their obligations. We'll make it as easy as possible for people to access the app or the online website to register their travel and their vaccination status, and we will be checking people more on a random basis, but we will be there for at least the next few weeks after the 23rd of November to ensure that people are doing the right thing as much as possible.
And following on from that, what are you going to be, how are you going to be policing people in isolation or quarantine, and will there be an educational approach, or will you take a little bit more heavy-handed?
We won't be changing our approach, Andrew. Right throughout the course of 2020 and 2021, we've been working with the community, providing support, providing advice. Some of that advice has been quite firm advice, but we've seen generally a high level of acceptance of that approach. We have taken action against people who blatantly disregard the directions. So we're not going to change our position on that. If people are trying to do the right thing, they'll be supported by the South Australia Police and SA Health. If they're ignoring the rules, then they may face consequences.
Commissioner, how many
Provide any further
mandatory
update?
vaccination? Sorry, is it today that the mandatory vaccination kicked in for the police force?
Yes,
And, how many staff have you lost as a result?
15th of November was the day when the requirement for all police staff to be vaccinated came into effect. It's still too early for us to tell just how many individuals will be affected by that in terms of their decision not to be vaccinated. Some of those people may still be on leave or considering their position in relation to that. So at this point in time, we're working with a number of around 200 police staff, plus some public servants. But it will be some time before we know the exact number of people who are electing not to be vaccinated and taking other leave accessing other leave requirements as a result.
Commissioner, as
added update
life gets
regarding-
more and more difficult for unvaccinated people, are you concerned about people at that extreme end of the anti-vax movement becoming more active in the community, perhaps threatening community safety?
Whether or not a person gets vaccinated is an individual choice. Whether they choose to protest is also their choice. But we will be there to ensure that any protest activity, any rallies are conducted safely and in accordance with the legislation. We will not stand in the way of people being able to express their views, but they must do so in a way that is consistent with every other type of assembly that we have in South Australia. You had a question?
Are you able to just provide an update regarding Samantha Sullivan, who fled the Medi Hotel earlier?
The current update is that we're still looking for her, so anyone who has information about her whereabouts, please make contact with Crime Stoppers or directly to SA Police. We are keen to get her back into the Medi Hotel, and I think that's in everyone's best interest. Reassuringly, she did, prior to leaving, she had been tested and it's a negative test, so the level of risk to the community is relatively low at this point, but we want her back in Medi Hotel.
Thanks, President. We need to go.
One more.
What are your thoughts on the fact that this even happened in the first place?
Oh, look, I think Assistant Commissioner Patterson explained that very well yesterday. These Medi hotels are not prisons. We're doing as much as we can to manage people whilst they're in our care in the Medi hotels. We've processed tens of thousands of people, and we've had 3 instances where someone's been able to sort of escape that security arrangement. It's not ideal, but it's something we're working through. We'll have a look at the circumstances of this one and take any remedial action. But I'm also hopeful that the requirement for Medi hotels will become a thing of the past sooner than later. Thank you.
Thanks, President. Thank you very much.
Oh my God.